Hey guys, what is up? It is Destiny and I'm here again with another video. So I know it's been a minute since I've recorded a video. Or posted a video. It's been 4 months and school is the reason why I haven't posted a video. However, I am here with another video, and for this video I am going to be discussing what you should expect in your first day of clinicals as a sonography student and some tips and advice that I've had for you all, just because I've been on a numerous amount of clinical sites, rotations, so I kind of know like what to expect. So if you would like to hear about those things, stay tuned. I have a couple of things that you should expect on your first day of clinical as a sonography student, and I have my iPad in front of me, so if you see me like pick up something or like look down, it's just because I'm looking at my iPad and I just want to stay on topic with everything and not ramble. So the first thing that I have for your first clinical day is to arrive early. I think this is just self-explanatory. I just feel like, as a student, you definitely want to just arrive early just to make yourself look good. And plus, since it is your first clinical site, you may not know where to go, so it's just important that you give yourself enough time to find out where you need to go, find the ultrasound department, find who you need to meet with, and just things like that. And also this kind of ties in with arriving early, but if you're at a site with another classmate, I do suggest y'all go there together, especially if it's your first day, because y'all are new ultrasound students, kind of don't really have an idea of like what to expect or what's going on. So like if you guys can carpool or like meet each other there and just like try to find the department together, that is awesome as well. I know my first clinical site, I was there with some other classmates, and one of my classmates, she actually picked me up from my apartment and we actually carpooled, and we found the ultrasound department together, and we kind of had each other along the way throughout the day to help each other out. So if you can carpool with the classmate, I think that would be good for you, and it kind of like keep stress levels down at a minimum, just because you're not there by yourself, and you can turn to like a classmate if you need to talk about something. Also, on your first day of clinicals, I do suggest trying to see where you fit in with the workflow. As a student, and this is completely normal to feel, chances are you're gonna feel like out of place and feel like you don't belong, and that's not true. My first clinical rotation, and even with my other clinical rotations on my first day, I just feel out of place because I feel like, where am I supposed to go? Like, where do I fit in with this workflow? And then sometimes, depending on how the department is, sometimes it can seem very chaotic and the sonographers are trying to figure things out, and you see that they're stressed, and now you're like, oh, like, should I just stay back? Like, what should I do? And me, y'all, I am a very observant person, and when I would notice this, I would just kind of figure out, okay, as a student, what can I do so I can make it seem less stressful? Or just what can I do as a student so I can try to fit myself into this workflow and figure out like what part can I play in this or whatever. And at times when they would just seem stressed, I would kind of just sit there and just let them figure it out, because like, as a new student, this is my first time like in the clinical setting, and I'm just like, I'm not really sure what to do. And on your first day, you're gonna seem like confused and just like, oh my gosh, what I do? Just take it step by step. I just say, just let it simmer down, or if it seems chaotic, just let it simmer down a little bit. Or just find the person that seems less stressed. When in doubt, find the person that seems less stressed, because I don't want to add to another sonographer's stress, by asking, can I come with them as a student, With what I just said, I just wanted to remind everyone that, when you're in clinical, this is part of your education. So you want to make sure that, you're not taking away from what you want to learn and what you want to gain from your time at being at the hospital. So, even if a sonographer seems stressed or whatever, don't let that make you not like go with them so you can learn. I mainly just made that point just to say that it's going to be chaotic in the hospital sometimes, and you're going to have to you're still learning, so it's important that you don't let the chaoticness kind of like scare you away from like learning. But that's something that you may come into contact in clinic. workflow may be very confused. You got orders just coming in, the sonographer is understaffed, and especially, you know, with some departments being understaffed, you know, as a student, that's where you can come in and help. It's like, oh, like, do you need me to go get the patient? Like, do you need me to do anything for you? And by you like doing that, you're letting the sonographer know, like, hey, like, this student really wants to help. Like, just don't sit back like on your phone and everything during clinicals, even your first day, and even like later down the line. Just don't do that. If anything, just read. Just trying to figure out the workflow the first day. It may take like a couple days to like figure out the workflow, but if you can figure out the workflow, you're gonna figure out how you can fit it into that department. And also another thing on your first day of clinical is learn where the linen is and learn where PPE is. Like, try to figure out, okay, where's linen? So if the sonographers need me to stock linen, I can stock linen. Also figure out where gloves, masks, gowns, goggles, find out where those things are, because in clinicals, you are gonna be utilizing those things as well, especially gloves, and especially if you go into a patient's room and they have contact precautions and stuff, or like any type of something going on, you may have to wear a gown. So just knowing where those things are in the department on your first day, you can go a long way with that, because you'll know where things are. Or for sonographers or stress, you'd be like, don't worry about it, I'll go get the linen, I'll go get some extra supplies. You know, just learning where things are in the department on the first day is really beneficial, because it's just like you're fitting in within the department, you're fitting in with the workflow, and it's just like it's smooth going in. Yeah. In my first day, in my program, we have this clinical site checklist, and we have to check off things such as that. We kind of learn the department phone number, closest exit, restroom, where to get patient orders. And I just feel like just knowing those things can like help you feel more comfortable within that department and feel like you're a part of the team, because it's just like over time you're going to feel like you're a part of the team in clinicals. And I think that's a good thing to know, because you want to, even though you're a student, you want to feel like you're included and feel like you belong there. And I think that that's a really good, especially a good feeling, because you don't want to feel out of place the entire time. So just knowing where like things are in the department can really benefit you on the first day, and even like later down the line, like if you go back to that rotation, you already know where things are. Another thing you should expect on your first day of clinic, or something that you should do, is bring a notepad. On your first day of clinic, depending on where you are in your program, you're probably not going to know a lot about like sonography, like if you're at a vascular location or abdominal or OBGYN location, whatever location you may be, it being your first clinical day or rotation, you may not know what you're looking at or what the sonographers are talking about. So I do suggest, like, if you're observing a exam, have a notepad with you, and if the sonographer is telling you things, write it down, because in the long run, when you're learning those things in class, you're gonna remember, oh, in clinic, I remember the sonographer was talking about that. It happens all the time, and it's like an aha moment, like every single time. Sometimes in class, we will learn stuff, and then I will go in the clinic and see it, and it's just like an aha moment. But always bring a notepad with you to write down even the exams you've done, just things that you know. And even if you don't know like what you should know about this exam, just ask the sonographer, hey, I don't have any questions, but what do you think I should take from this exam? Because I know there were plenty of times where like I didn't know what I should ask, because, you know, I was a new ultrasound student, had really never seen, you know, this anatomy and everything like that. And I would just ask them, what do you think I should take from this exam? And I would just write it down. And I also have one of my notepads with me. This is just one. I have like a bunch of them. This is just a notepad I got. And then these are just I would just write down like I would do like the exams that I did, and if I observed or partially scanned it. And then this is just a fetal spine. This was when I was at an OB/GYN location, but this is just like, I would just write little things down like this. But I do suggest getting one of these, keeping it in your pocket at all times. Always keep a pen on you. That's just me, because, you know, you just want to write down stuff, so if you need to reference it back or you have a question about it, you was like, oh yeah, I wrote it down, I have a question about such and such. but these will really come in handy. I think I have like 3 of these. 2 of them are full and this one is almost full, but invest in these. I got these from Target, not sponsored, but having a notepad in clinic is very beneficial on your first day, especially because you don't really know anything, and if you're just writing, you just write stuff down that the sonographer thinks you should know, or which you should know. Because I know my first day, or it was my first rotation like that I had, but the sonographer, I was looking at the screen, had not one clue what I was looking at. But I remember the sonographer was pointing out like the hepatic veins and the liver, the Playboy bunny sign and stuff like that. And I remember I wrote it down. And then in abdominal sonography, like the actual class, we were talking about it. And I was like, oh, I remember that from clinic. So things, you may not know it at first, or you may like write it down and then later down the line, you're gonna see it again. But with ultrasound, I would never have thought that I would know as much as I do now, because during my first clinical day, I was seeing all the anatomy and everything. I was like, how in the world am I supposed to know all of this stuff? How am I supposed to grasp the concept of this? Because this mess looks so hard. But y'all, I promise you, the more that you see that anatomy, the more that you practice and study, it's gonna come like that. Like me, I have 1 more year left, and I have learned so much in the past year, and I can like, give me an image right now, I can tell you exactly what it is. And like, I remember like my first day, I was like, I do not know what this is. And you kind of start to panic a little bit, because you're just like, what did I get myself into? But in the moment, it may seem very stressful, and like, you're like, oh my gosh, like I'm really about to do this. And as you go through the course of the semesters and months, it's gonna come so easily, and you're gonna be just fine, because I'm in my last year. I only have 3 more semesters, and I'm gonna be graduating and taking my boards. Also, on your first day of clinicals, or even just your first site, go with the sonographers that you know you will learn the most from. Some sonographers are very good teachers, and those are the ones that you need to go with. And sometimes it can be hard when you're at a site with another classmate, because they're gonna see that they're gonna want to go with the good teachers, and then you're kind of stuck with like the not so good teachers. And it's just like, that's where you have to put your foot down, because this is your education, and at the same time, you don't want to mess with anybody's education. But at the same time, like this meme where we use, I gotta put me first. That's literally what you gotta do. Don't let, in clinicals, with your first day, and even like later down the line, don't let anybody step over you. You have to be aggressive, because this is your education. And when it comes to applying to jobs, they're going to choose the best ultrasound candidate, and you want to be the best candidate for that job. And it's just like, go. That's why, y'all, I love going to a site with no other. I love being at a site by myself, because I get to choose who I want to work with. First clinical day, like last year, I didn't really have that problem, even though I was there with 2 other classmates. We didn't know anything, so it kind of didn't matter at the time. But I know later on, throughout the year, I was at a site with the other classmate, and it was kind of becoming challenging, because it's just like, I don't want to take away from her education, but at the same time, I'm getting the short end of the stick. So you want to be very aggressive when you're in clinicals. Like, that's what, like, y'all, I would get there early and be like, I'm doing outpatient, or I'm doing this, or I want to do these exams today. And you got to be very aggressive. And going back to going with the best sonographers, go with the sonographers that are going to teach you, because as a student, you want to be that student that really knows their stuff, or has that determination, has that passion. And because some of sonographers, they are really good teachers, and you're just like, oh my gosh, I want to be that. Like at some of my rotations, not just my first one, but some of those sonographers were just such good teachers, had so much knowledge, and I was just like, I want to reach that. I want to be at that level eventually. And it's just like, in clinicals, go with the best teachers. Some people are better teachers than others, and some sonographers just plain out don't like students. But don't take that don't take offense to that. Just don't work with them. If you can help it, just don't work with them, because I definitely did that. I would not work with them. If you don't like students, I don't really care. I'll just go with somebody else. But if then in that case, if they don't like students and you have to work with them, if you can like work around them, that's fine. I've been in positions where I've worked with, you know, somebody that didn't really particularly like students, but I knew how to work around that sonographer. And I never had any problems with her. She never caused me any problems. And, you know, she was very knowledgeable and I learned a lot from her. So as long as they're not rude to you, you're fine. But like I said, go with the best teachers, because that's going to enhance your education and enhance your knowledge, and that's going to benefit you as a student and even as a future sonographer. So with that being said, I really hope you guys enjoyed this video. Please make sure you like, comment, and subscribe for more content, and I'll be back with another video very soon. Bye, y'all.